Hi, my name is Eddie Mitchell. This is CRM711. I am doing my topic of interest presentation, and I chose to discuss T cell or CAR T therapies in clinical research studies and the role ethics plays in subject participation. For the past 4 years, I have had the benefit of working on multiple protocols that involve T cell therapy, and it is a fairly new type of research, but it is incredible and has been incredibly beneficial as I've seen for patients. I like to think of it as very similar to where immunotherapy was about 10 years ago. Early development, not a lot known about it, but the benefits are tremendous. I just want to first talk about what T cell and CAR T therapy is. It is a fairly new form of treatment and it is being utilized in many clinical research studies. Specifically in oncology is where I have had the experience of working in T cell and CAR T. In this type of treatment, we are looking to take a patient's T cells and we alter them with our investigational product so that they will, when they get infused back into the patient's body, the thought is that they will then attack the cancer cells. So the process typically is that we have a patient who wants to move forward with our study. We would apheresis the patient, which is we have a machine that takes the blood out of the patient and it can separate the T cells. So then after apheresis, we take those T cells and we manufacture the T cells with our investigational product that is a specific type of receptor that we know is going to go in and attack these tumor cells. So once we have manufactured, which usually it can take anywhere, depending on the study, it can take anywhere from 2 weeks to 30 days to harvest these cells. They're then frozen and sent back to the hospital. And when the patient is ready, the patient will be moving forward with our treatment. They go through something we call lymphodepletion chemotherapy. So they will receive an aggressive type of chemotherapy for a couple of days that basically takes their immune system down to nothing. So they're very weak and compromised. We then utilize that the T cells by infusing them back into the patient's body while their immune system is so weak in the hopes that then the T cells go and attack those cancer cells. Um, some of the things why this does sound like very simple. I'm giving it to in simple terms, but some of the things to keep in mind for this is that patients do suffer adverse events because of the intense lymphodepletion chemotherapies. We see a lot of cytopenias, thrombocytopenias. The patient's blood counts go down to almost nothing. Um, Another thing we see once the patient has their T cells infused are cytokine release syndrome, which can result in fever, fatigue, nausea. We actually see this as a benefit when patients have this CRS because it means that the T cells are actually working and they're doing their job. But we also have seen neurological difficulties in patients where we utilize something called ICE. That's a questionnaire that patients are observed and monitored for neurological issues because we want to make sure that the patients are not are not having experiencing any of those discomforts while they're once they've received treatment. So after the patient receives those T cells, they're monitored heavily. They come back into clinic. Their labs are drawn. They're observed in the hopes of eventually taking scans of the patient to see if we are having any kind of response or regression of the tumor. I think the major question for patients who are involved in clinical research is how do they make the decision between standard of care treatment or an investigational T cell treatment? So, standard of care treatment is the treatment, specifically in oncology, that experts agree is the appropriate, accepted, and widely used for that specific tumor type. So, you don't want to get that confused with clinical research where we have research that's testing an objective, we're trying to improve the standard of care. We're measuring effects over a period of time, and we're focusing on safety and efficacy for the subjects. So the patient needs to be clear on the standard of care versus clinical research so that from an ethical standpoint, they understand what they're getting involved in. Some of the things to consider when a patient's making the determination, do I want to receive that standard of care or do I want to try an investigational T cell treatment, is has the patient exhausted all of their lines of standard of care treatment? Some of the oncology patients that I have seen might have upwards of 5 or 6 lines of treatment. They've exhausted all aspects and they think that this is a chance to still improve their quality of life or have some sort of tumor regression. Typically, that's considered a salvage type of therapy, which I think for T cell therapy, to be able to gain the knowledge and the data that to be effective, it doesn't need to be considered that. It needs to be T cell therapy should be something that patients look to early on to see the effects. But it is hard, and I completely understand where patients are coming from when they know we already have a type of treatment that is going to be beneficial to you or should be beneficial to you because it's FDA approved versus a treatment that may or may not be beneficial to you. Another thing to consider is the study a good fit for the subject and their family? Like any clinical research study, uh, these protocols are very in depth. They require a lot. For T cell therapy, patients are hospitalized for over the lymphodepletion, and even after they receive the T cells to be observed because we just don't want to send them home and they have some serious adverse events. So, patients being able to participate and complete all the assessments that are involved. It can be very time consuming. It's a big commitment. So that's one of the things where standard of care, they might just go in on day 1, day 15, or even once every month and receive their standard of care treatment and be on their way. Another thing to consider is will the subject benefit from their participation? This is kind of a loaded question because I think if the patient is considering the clinical study, they have some sort of benefit that they feel they will gain from participating, whether it be quality of life, whether it be towards science. We have a lot of patients who are very interested in participating in clinical studies because they know that the information they can provide will be so beneficial for others who are in the same situation they are in. At every site, the IRB plays a major role in the clinical study. So the IRB's role in assisting with subjects' decision from an ethical standpoint, it's imperative subjects wanting to participate in the T cell therapy study are fully informed and understand that this therapy is still in its early stages of development and that it is a high demand study. So the IRB takes responsibility to make sure that patients are aware of all the risks and benefits that come along with the T cell clinical studies, safety concerns, as I mentioned, some of the adverse events, time and commitment that is involved with these studies, and then the risk versus benefit. And the IRB should confirm that the study is using an informed consent, and more importantly, an informed consent process that makes the subjects fully aware of all that the study involves. And when I say informed consent process, I'm talking about the physician and coordinators sitting down with the patient before they consent and thoroughly going over everything that's involved in the study. The physician and the PI or the study coordinators should, through training, have a good understanding of all the uh, nuances of the study, the details, everything that the patient is going to go through. So they should be able to answer any questions, discuss the study with them, and make sure the patient feels comfortable. And then in doing that, also highlighting what the informed consent says and what the patients are agreeing to. The informed consent process and ethics go hand in hand, and that's something that we've really focused on in CRM711, specifically in the Model 5 readings. The informed consent process is key to providing an understanding to the study subjects that they're considered to participating in and what's involved. One of the articles was the OHRP Elements of the Informed Consent 45 CFR 46.116, which talks about all the requirements that are involved. And I just wanted to highlight on two. One being that the informed consent is concise and focused on key information that is most likely to assist a prospective subject in understanding the reasons when one might or might not want to participate in the study. I think this is really key because you can go over everything that's involved with their participation, but if the patient doesn't understand, they might look at a study and say, "Oh, why wouldn't I want to participate? I'm going to benefit from this, and this is going to be great, and I'll be cured." When they really need to understand everything that's involved, why they might benefit from it, but they're going to go through a lot as part of their participation. I also the other point is that I pulled from that document is that the patients understand that the informed consent documents and the foreseeable risks and benefits of the subject. I know I've worked on a study, one of the T cell studies that it can involve some ocular adverse events that we've seen, and one thing to think about with a patient is it's easy to say, hey, you might have some ocular adverse events, but until the patient wakes up and they can't read their newspaper because of something. Because of the ocular adverse events, or they can't read their email and they panic, it really doesn't set in. So making sure that the patients are aware of those risks, but also talking about the benefits that can come from the patient participation is key. Getting them excited about the study and wanting to participate. So we do all this through the informed consent process. So the informed consent process requires good communications of study risks and benefits by the consenter, as I mentioned before, the physician or the study coordinators, so that the potential subject can decide whether or not to participate. And the key, again, to a great informed consent is the ICF discussion between those coordinators, physicians, and potential subjects. Even though T cell therapy is a fairly new form of research, we obviously want to make sure that it is meeting the ethical requirements set forth by the FDA. One of the points that I talked about in my topic of interest paper was that in China in 2016, a student actually passed away during a T cell therapy clinical trial due to inadequate oversight by the physicians, the hospital, and the study staff. So uh, it caused quite a media uproar, and China actually issued and enforced several policies stemming from the incident for scientific development of cellular therapy technology. So they want to avoid this happening with any other patients that are participating. To date, we've not seen any major issues within cell therapy in the United States, but I attribute that mostly due to the strict FDA rules and regulations. So, uh, patients should know that even though they are going to risk some adverse events, due to the oversight that's really strictly monitored for these studies, the patients should feel comfortable that their safety is the number one top priority when participating in these clinical studies. Finally, T cell therapy clinical studies have the potential to save many lives and improve overall quality of life for subjects, even though we are in the early phases. I know firsthand knowledge, seeing some of these patients' overall quality of life improve from receiving T cell therapy over years. When they didn't have all that much time left after their most recent line of therapy, seeing these clinical benefits. It doesn't happen for everybody that way, but even for one patient, it improving it means the world, and it's such a great benefit for them and their family. Saying that, we also need to make sure that the implementation of ethical guidelines at a sponsor and site level during the T cell process is protecting and bringing about ultimate fairness that is needed to protect these subjects' rights. So, as long as subjects have a clear understanding that they're contributing to the overall science and the requirements of research, ethical guidelines will be met. I think that T cell therapy is a huge factor for the future in benefiting patients, and I hope that we use the tools like the informed consent process, our IRBs, and overall ethical participation is maintained, and we get to benefit from T cell therapy. So thank you very much for listening. I appreciate it.